that we are not going to back down. So let's keep that message going. As we move through the summer, hopefully we can get some of these letters to the editor plugged in across the community and keep this message going right through to the fall.
I wanted to just recognize and thank ONA for all of your work and support with the Health Coalition. I know many of you are involved in your local health coalitions and over the years have been getting more involved, and it's been really tremendous working with you. I really appreciate that that in ONA there is such a depth of belief in social justice and in the idea or the vision of nurses being advocates for your patients. And in Canada it has really meant that we've been able to protect to a large extent the public healthcare system, whereas in other countries, you know, it's been lost, largely lost.
Thank you for coming to the Region 3 hosted PCM. Open skies and green landscapes, typical Region 3 scenery. See you in November. Bye, Gloria.
Pleaded guilty to 2 charges out of 9, and they got a $70,000 fine, each $35,000. I am somewhat disappointed. I'm happy that this is the first charge for violence in the workplace under the Occupational Health and Safety Act, so it does open the door to assist, but I'm disappointed that they pleaded guilty to only 2 and that the fine was so small.
How long has it been since the attack?
Well, since the attack, 21 months. 21 months, and you know, I'm still suffering. I mean, whatever I do per day, I suffer. If I lie, I suffer. If I sit, I suffer. You know, I've gone through something like 6 surgeries, and I'm still expecting that there's going to be 2 more.
It's hopefully around where we can actually, because they've been charged, say to the employer, you have been charged, we'll do it again. So now you need to come to the table and you need to put your money where your mouth is. And you need to follow this through, and we need to see that you're actually serious about this, because if you're not, we'll go back to court. Quite willing to go there and we'll do it again.
Hi, I'm Haslam-Stroud, and I'm really excited to be continuing as your provincial president for the 2010-2011 term of office.
Working with this committed board of directors and a committed staff team that we have here in ONA is a great experience, and I very much look forward to the 2 years ahead. Thank you so much.
The panel discussion today at the Ontario Health Coalition, it was a high-level briefing of the new regulations that just came out from the Ministry of Health. We were discussing the staffing levels, the lack thereof actually, and how we all want to give quality resident care. ONA is adamant that it's registered nurses that need to provide quality resident care because we have the assessment skills, we have the knowledge base, we actually can do all of the jobs. With the acuity of residents now coming into long-term care, they require RN. They have multi-problems now, not only physiological but behavioral, cognitive, and we have been trained to deal with those types of issues. During the panel discussion, one thing that did surprise me was the fact that so many families fear retribution if they report neglect or an abuse or not good quality care. That really saddens me because most of us are there to give good quality care, and I would hope that they would see that and would have the courage to come forth if they're seeing something, or if not to talk to management, at least talk to the charge nurse, and that so that something can be done about it. But to say that they fear retaliation that's sad, and I would say that none of us do that.